Call the meeting to order. And we're recording has started. It started off by just simply, as Mayor Struthers had noticed, Cogeco is recording our session. And I'm also aware that reporter Wayne Lowry from the Recorder and Times is on the call. I also wanted to let you know that I had a call from Mayor Brett Todd, who a personal issue has arisen that prevents him from attending today, so he will not be participating. That's leading us to the second item on our agenda, which is our traditional land acknowledgement statement, which I'll read, and I do each meeting. Leeds and Grenville and Lanark are located on the traditional territories of Anishinaabeg, Huron-Wendat, Haudenosaunee, and Oneida, dating back countless generations. We would like to show our respect to Indigenous peoples for their contribution and recognize the role of treaty making in what is now Ontario. Hundreds of years after the first treaties were signed, they are still relevant today. With that, I have a motion, and we're moving to the item approval of agenda. As I've done at previous meetings, I've assigned the movers and seconders. Just kindly let me know if you have a concern and wish to have your name replaced by someone else. Otherwise, I'll just go ahead with the motion. So for this motion of approval of agenda, it is moved by Ann Warren, seconded by Doug Struthers. Motion reads that the agenda of the June 24th, 2021 regular meeting be approved as circulated. Members of this board, is there any errors, or sorry, any additions that anybody wants considered for agenda?
No.
I'm seeing none. Is there any objection to my declaring this motion carried? Hearing none, I declare the motion carried. With our agenda in hand, I ask if anybody has a conflict of interest that they should declare, and if so, if they could provide us with the reasons for that declaration.
None.
I'm seeing none, and so we're moving quickly, and we're on to the consent agenda, and I have a motion for that. It is moved by Cheryl Smith, seconded by Peter McKenna. Motion reads that the following items on the consent agenda be approved as circulated. They include 5.1 minutes from the Board of Health regular meeting held on May 20th, 2021, 5.2 general correspondence, 5.3 MOH CEO duty of care report, and 5.4 governance and quality assurance committee duty of care report. Is there any member of the board that wants any of those items separated before I call the question on the motion?
No.
I'm seeing none. Therefore, I will call the question by asking, is there anybody objects to my declaring this motion carried? Hearing no objection, the motion is carried. Thank you all. This brings us to item 5.2 general, this brings us to 6.1, which is business arising, and this is dealing with the public appointments. I think you're aware, if not, I'm certainly going to confirm it, that we have a notice from the Executive Council of Ontario Ordering Council appointing Cheryl Smith for a period not exceeding 2 years, effective June 25th, 2021, going on to June 24th, 2023. And you are aware, I believe, that some time ago, our member Tony Circo was similarly granted or appointment, and hers is effective from May 28th, 2021 to May 27th, 2022. Heather, if I've got that wrong, please correct me, because I think that should also read 23. But I just want to say in passing that it was important in order to get our appointments in place before they ran out. And I have to thank MPP Steve Clark and his office for his assistance in our getting those appointment notices through. And just to say, I'm so pleased as chair that Cheryl and Tony are reappointed because of their valuable input on this committee. So yes, indeed, Bill. Thank you so much. So unless there's any comments or questions on that to be entertained, I'm going to go on to item 7, which is new business finance audit report and risk management committee report. Tony Circo is going to lead the discussion on this. And I have a motion which I'll read and then turn it over to Tony. The motion reads, and I have, it was moved by Tony Circo, seconded by Bill Dobson. The motion reads that the 2020 audited statement be approved as circulated. So with that, Tony, I'll turn it over to you. And I know that Serena has a presentation.
Thank you very much. So I'm just going to go ahead and introduce Serena Deschamps, who is the auditor for Allen and Partners. And Serena has just finished the major portion of the audit that we look at this year. So Serena, I'm just going to turn it over to you.
Great, thanks. Can everybody hear me?
Yes, we can.
All right, so I'm hoping everybody got a copy of the financial statements.
Yes.
Yeah. Okay, so I was going to just start on, page 6, which is the statement of operations and accumulated surplus. I'll give you a second to flip over there. Good. Everybody good?
Would you give me that page again, Serena?
Page 6, I believe.
Page 6, okay. I'm there,
be-
everyone else is.
Yeah. Okay, so our statement of operations and accumulated surplus, that highlights for us our results from the year. So what we see at the top in the revenue line there, interestingly, is our revenues came in $2 million over budget this year. But that's largely related to the COVID funding that we received in the year. You can see in the middle there, $2.27 million that was not budgeted for. Can everybody see that?
Yes.
So that was not just one kind of lump sum payment. That was due to several different programs, but mostly to help us through the COVID situation. And you can see actually down below in the expenses where you see third line down, other related programs, our actual expenses of $2.29 million compared to $100,000 budgeted. So that relates to our extra expenses that we incurred directly related to COVID. What we can also see actually is we had budgeted for the Ontario Seniors Dental Program. So that was kind of exciting to see. And that came in almost exactly on budget. So that was great work, even through all the difficulties in the year. And then also what we've seen and also seen at the municipal level is the land control revenues. So the land control revenues are over budget by over $100,000. And we've actually come in with a surplus in that department in the year of over $100,000. And again, we've seen that at the municipal level. Lots of building was going on, I guess, as people stayed at home. So that was good to see too. So what you see at the bottom of the page there is an annual deficit, very small, $3,000 on our $18 million of operations. So really, you know, our activities came in pretty much exactly as we budgeted, save for the pandemic, but we did get revenues right at the end of the year and kind of right after the end. We were all excited to see that come in to cover our extraordinary expenses. Did anybody have any questions on that statement? Nope. So maybe we'll just go back one page then to the statement of financial position. So on that statement, that's our balance sheet. So a snapshot of exactly where we stood right at December 31st. You can see there, our cash is about the same as last year. Our receivables at 1.3 million. Again, that's because the ministry came through with the COVID funding, about $1 million of it, I'm going to say, after the year end. We got the cash. I remember getting a phone call to say the amount got deposited into bank accounts. So that also was kind of exciting to hear. And then down below, we can see the accounts payable is up $1 million. Makes sense because we had all of the extraordinary expenses, but we didn't have the cash in our bank yet to actually pay for them. Did anybody have any questions on that statement? No. So what we can see right down at the bottom, the accumulated surplus, small change from last year, just down the $3,000, our small deficit that we incurred in the year. So those were really the high points of the financial statements. I think, again, it's a good news story when we consider everything that went on last year and all the extra efforts, made by the staff at the health unit and by the ministry for funding all of those efforts for us. So I'd be happy to answer any questions on the rest of the statements if anybody had any.
So we have Peter McKenna, Serena. Go ahead, Peter.
Thank you very much, Serena. Mr. Chair, my question is more about the audit itself, and perhaps Dr. Stewart. If a member of the public wanted a copy of the audit, are they available at the front offices of Smiths Falls and Brockville or other places? Or how would a person get a hold of a copy if they wanted one?
Well, I'll answer that. It's posted on the website, Peter, under the Board of Health section. All the audited statements are there.
So follow up, Peter. Is there anyone else? Bill, go ahead, Bill Dobson.
Thank you. Just a quick question. This doesn't have to do with the audit this year, but just looking ahead, I think that we've heard that the provincial government is going to be earmarking increases in funding for hospital operations, and I'm just wondering, do we have any programs that are sort of interrelated to the hospitals, which may in turn affect our budget next year if there's more funding coming in from the provincial government?
Yeah.
That sounds like a question for you, Dr. Stewart.
Yeah. So we work on many projects with them. All the maternal child program that we have where the nurses are actually in the hospital helping and so on. But that's just the work that we do. Our funding is not tied to the hospitals at all. So we wouldn't benefit from that. We're still waiting to hear from the ministry about what the funding would be for next year.
Okay, thank you.
Okay, thank you very much, Bill. Is there anyone else? All right, without that, if there's no further questions, then I'll just repeat the motion. The motion is that the 2020 audit statement be approved as circulated. Is there any member that objects to my declaring this motion carried? Seeing none, the motion is carried. Thanks so much. That will move us to 7.1.2 management letter. It is addressed to the, did you want to speak before we move, Dr. Stewart? Go ahead.
Yeah, I wanted to say thanks to Serena for all the work that you did. We set it up so we were safe in COVID, and your team did a really good job with all the review. So thank you very much. I think this is a really important part of looking at provincial and municipal funding that we have. So to be able to get a good audit was really important, and thank you very much for all that work with your team.
No, you're very welcome. And I should say the same actually, because your staff made it very comfortable for us to come into the building and feel safe being there. I know it's difficult even for your staff to have us come in because we're going sort of from building to building doing the audit. So no, I think it was a really good job this year for sure.
Certainly, I repeat that. Thank you. Although you're not finished yet, Serena, we have, did you want to speak to 7.12, Doug, or did you want to speak to the audited financial report?
Probably fits into both. And if I might, I'm certainly prepared to defer to our finance and audit chairperson, Tony, that our meeting last week was a really, really good meeting. Obviously the same information for the full board today. The numbers are good. The text is good. We have presented to us, particularly the conversation that the committee members had, and that just really underscores that we've been, that the health unit and all the staff have been, particularly last year during the pandemic, but as a general statement, are managing the finances of our health unit very, very well. And I don't think I've overstated that, Tony. I would defer to Tony if she wanted to add anything to that. But I think it's important for the full board to know that we had a very, very good conversation over with our time going over the audit this year, as well as the board today. So thank you.
Thanks, Mr. Chair. I'll just echo Doug's comments. I never believed we would balance at the end of last year. And there were many times I never thought we would meet our monthly expenses. It was an extraordinary year. Some people don't get excited about finances and the bottom line. I do. So I was thrilled by this audit and the bottom line, a deficit of like $3,000. Thanks to the very, very sound fiscal management of the staff, the levies from the municipality, the ministry flow through funding, and just all the goodwill of everyone to just make this happen. So, and thank you, Serena, again, for your role in this audit. We appreciate it.
Okay, thank you, Tony. We're not quite finished with our audit. 7.1.2 is a management letter addressed to myself as board chair. It comments on some observations made at the previous audit and essentially indicates that it should continue in that direction. Did you want to address it, Serena? Because I see in my agenda here, I have your name
My
indicated.
initials there.
So did you just want to comment on the PASAB basis and the asset management plan comments?
Yep. So I think we've commented on in years prior, and again, it's not a comment on a significant internal control deficiency by any means. We really just like to highlight the importance of these long-range financial plans. We feel they're important for the planning of the health unit. Again, our assets are recorded in our financial statements at cost and now at amortized cost on the balance sheet. So that doesn't accurately reflect, you know, the true replacement cost of the assets or even the cost it's going to entail to maintain them. So these long range plans, again, they can be powerful. I know you've heard this message at the municipal level to determine what we need to set aside, knowing the health unit can't really do that, but what we're going to need to maintain the assets going forward.
Right, thank you. Does anybody have any comments or questions on that? I just wondered, Dr. Stewart, if you want to comment on the reaction of the health unit. It's, I guess the matter is being taken in hand. The consideration for the observation is being taken seriously. So did you have anything to add?
I would say that we will work this year to include the amortization in the budget. And I've talked to Tony about how they used to do it at the hospital. So we'll look at that and do that for sure. And the asset management plan, I think actually the timing is right for us to be looking at this. About 2 or 4 years ago, we did a thorough look of everything. And I think that now is the time when we should redo that thorough look and bring it to the finance audit property risk management committee. So I think that the timing is good for this. We had done a really thorough one that 3 or 4 years ago when we had the roof and the parking lot. There were a lot of things that we were able to apply for funding for from the Ministry of Health to do. So I think the timing is to take another good hard look at it now.
Great, thank you very much. All right, with that, we have a new member of staff, and 7.13, Dr. Stewart, you're going to make the introduction of Sophia Wang.
Yeah, so I'm really pleased to introduce Sophia to you. I'll let her say a few words about herself. She has jumped right in to the multitasking that's involved in the finance property manager position. Is complex, and the complexity of adding COVID to it, and all the one-time costs in the provinces to get ready for the Q2 report. And Sophia, with a smile and enthusiasm, has embraced the work. And we are really pleased that Jackie MP, who came in when we were short right at the beginning, has come in to stabilize the team and has been mentoring Sophia. Jackie is going to be here until July 2nd to help Sophia, and then is available as needed. I don't know that she's going to come off the golf course to come and help Sophia, but she'll be available as well. And it just, you know, it's interesting because just going through this with Sophia, I realized the complexity of our world. You know, we talk about the lakes, ponds, and the puddles, and the finances are complicated. So I'll let Sophia introduce herself to you.
Thank you, Paula, and good afternoon, everyone. It's very nice to meet everyone here today. My name is Sophia Wang. I go by Sophia. Ran is my official name. So as Paula said, I'm the new finance and property manager at the health unit. I started my position on the Monday, June 7th. So I'll be here for almost 3 weeks. By Friday, I'll be 3 full weeks now. I am a CPA. I have about 10 years of working experience in public accounting. So the majority of my previous employment were with CPA firms. So that's where I was looking after client accounts in terms of financial reporting. So it's the preparation of financial statements as well as filing of taxes. My last firm was MNP LLP in downtown Brockville. I was with the firm for 6 years and I was a manager there. So I was looking for a change in my career, still within the finance and accounting field, but I was looking for something different, like than financial statements on a daily. So I was hoping to get more exposure in the business and administration side of things, I guess. And this job post came up, and that interested me. So I applied for it, and here I am today. So I've been here for 3 weeks. Jackie and I have been doing a lot of orientation and training. I am very lucky to have her coming back from her retirement and to help me out. Yeah, I'm really, really thankful for her. And so there has been a lot of learning and juggling around different tasks, as Paula has said. But I find it very interesting. It's the good difference that I was looking for. So it's been great. I'm enjoying it so far. Yeah, so I'm very happy to be here and be part of the team, and I look forward to working with everyone going forward.
Great. Thank you so much, Sophia. And on behalf of the board and board members, welcome aboard. And
Thank you.
Thank you, Doug. This then takes us to a needed update in signing authority. And I have that as item 7.1.4. The motion is moved by Jeff Earl, seconded by Ann Warren. It reads that effective June 24th, 2021, the signing officers for the Corporation of Leeds, Grenville, and Lanark District Health Unit are as follows. Medical Officer of Health, Dr. Paula Stewart. Finance and Property Manager, Sophia Wang. Chair, Doug Malanka, and Director, Shawnee Gates. Is there any discussion before I call the question? Seeing none, is there any member that objects to my declaring this motion carried? It is so carried and noted. Thank you very much. We're then on now to the MOH update, item 7.2. And for that, I turn in the floor over to Dr. Stewart.
Does Peter had his hand up for a question?
I apologize, Peter. Go ahead.
Sorry, Mr. Chair, it was relating to the management letter. I just was curious, was there a motion to go with the management letter, or did we have to receive it or not? If we do, we didn't do it. If we don't, sorry for the interruption.
I had a conversation with Heather earlier, and we thought it wasn't necessary.
Okay, that's fine with me. Thank you.
Okay, thank you then.
Okay, so the number of new infections is very low throughout Lanark, Leeds, and Grenville. I think we have 3 active cases, and what that means is that there are 3 people that are within their 10-day period of being infectious with COVID, and we are very close to moving out of that. So it'll be a great day when we have 0, and you'll hear us celebrating. The whole last month has been really, really good. No outbreaks, no hospitalizations. And I think it's in large part because our community has been adhering to the public health precautions and the step 1 regulations, and just as important, the high level of vaccine coverage in our population. As of Monday, June 21st, we had 83% of our population 18 plus who received at least 1 dose of the vaccine, and 20% their second dose. That's 125,594 people have received the first dose. Like it's a big, big number. And we are within the top health units in terms of percentage of the population that has received one dose. And that's through our clinics, that's through primary care, and that's through the pharmacy. And for the youth program, we just started on it. We already have 56% of our 12 to 17-year-olds who have received the first dose of the vaccine. And that was, we had the 2-week blitz, and that was just at the start of the second week. So it's going to be much higher than that. We've had questions from parents about the risk of pericarditis and myocarditis, which is an inflammation of the lining around the heart and the heart muscle itself. This is not an uncommon inflammation that happens, particularly in young people and particularly in boys rather than girls, which is really interesting. It tends to be sort of in the under 30 age group. And so there are some countries that have given a lot more messenger RNA vaccine than we have and are detecting a very low signal. Like we're talking maybe in the teens out of 1 million doses, so very, very low. And it's a mild infection, might have some chest pain. It's treated with anti-inflammatories, and there isn't any long-term heart damage. So we've been answering a lot of questions about that. We're waiting for a statement from the National Immunization, the National Committee on Immunization sometime next week. They've been reviewing the data from all the different countries, and we'll get a little bit more information about that. But I've been answering a lot of questions about that. Our municipalities are the best. We have 10 municipalities that are arranging community clinics, and they're in Carlton Place, Perth, Lanark Village, Beckwith, Westport, Gananoque, Elgin, Aspen, Portland, and newly added Cardinal. And those municipalities are actually organizing the volunteers, they're providing the space. We come in with our team and arrange the healthcare providers via the vaccine. We could not be having those high numbers without the participation of our municipalities. It's absolutely fantastic. We're just in the process of completing the ones for youth, and then we'll have some more in July. So I can't thank our municipalities as much. It's too much. It's just absolutely fantastic. The health unit is going to do our part in terms of providing a clinic. On June 29th, the health unit, all of us, are going to be offering the clinic at Smith Falls on June 29th. And so I will be there. They will tell me whether I'm going to be a screener or security or something. It's a way for the health unit as a whole to be able to give to the community. So it's going to be a big clinic. We already have, I think, 500 of the appointments that are already filled up. So this is going to be our way of contributing directly to the vaccine program as a health unit, and really an opportunity for some of the staff who've been involved in some of the more difficult parts of it, like working with families who have COVID, some of the deaths we've experienced. And the vaccine part of it is the part of it that is the prevention part of it. And if we do the prevention well, then we won't have the challenges we've had before. So really looking forward to that. Now, we continue to have many of our pharmacies giving both Pfizer and Moderna. That is another one of the reasons why we're doing so well with our numbers. Also, our primary care providers, some of them put on clinics with 500 or 600 people at a time from the practice, and then bringing in other people from our communities. We have been giving a major message that it is okay to mix the Pfizer, Moderna, and the AstraZeneca vaccine. NACI has come out in support of it. And our vaccine this week, we had our Pfizer shipment was actually delayed from Monday to Wednesday. And so we had to fill in all of those Pfizer clinics with Moderna. And so we're now telling people it's a messenger RNA clinic. You may get Pfizer, you may get Moderna. And it's going very, very well. If people really adamantly want one or t'other, then we will work with them to book another appointment, but it's very, very small numbers. People are understanding the important thing is to get that second dose. Yeah. So the other thing that's exciting is that we have many people coming back from the States who have had 1 or 2 doses there. So We've now got new information up on our website that if you had one dose, just go to the clinic, book, and go to the clinic with your certificate that you received the previous dose, and we will enter it into the system so it counts. If you've already had 2 doses, then go on our website. There's information about how to let us know about it. If you can copy the certificate, you can either drop it off at a health unit office or you can submit it through the mail. And people are really keen to say, count me, I want to be counted. So we'll be able to count you. On other non-COVID things, we've seen an increase, starting to see an increase in Lyme disease infections. You know that we are one of the dominant places to have ticks that are carrying the bacteria that causes Lyme disease. So people are reminded to do tick checks when they come in from being outside in nature or really just in your yard. If you have big deciduous trees, because that's where the ticks like to overwinter and where they like to hide and protect themselves. It's interesting that the people have become so much more aware of infection control practices that we're now getting complaints or people are saying, I was at such and such a place and I think they weren't sanitizing things properly. So, which we like, that's part of the role of the public health inspectors is to make sure that those precautions are in place. Very busy working with the day camp organizers and now overnight camps. With the opening into step 2, it means that the overnight camps can actually start on June 30th. So are working with the camp to make sure all the precautions are in place. For the overnight camp, then both the counselors and the campers need to have a COVID test within the 3 days of going to camp. We don't have any pharmacies that are offering that. So our assessment centers have stepped up and said that young people who are going to camp can go to an assessment center to be able to get the test done, which I really, really appreciate. Beach sampling is starting next week. It's that time. So we have 23 beaches, north and south. The results are posted on the website. And before we had COVID, this was the most popular site on our website, but now it's going to have to compete with John's Maps and stuff, which are also really, really popular. Our public health inspectors are also visiting all the regulated premises that have opened up. So we're really pleased that the COVID outbreaks are going down in workplaces and services because we're now having to ramp up all the other work that we're doing. And the last thing I want to say is that our communication team has done a fabulous job of keeping our website up to date, keeping me informed for all of our media, keeping our social media up to date. And they decided that we would do an evaluation of our 6 sites just to see how well we're doing. We've had 2,000 responses to the survey, lots of really, really good feedback, some suggestions that we will incorporate into the clinics. And the last thing I want to say is that the communications team has even created a video of what it's like to go to the vaccine clinic just for you. But that's for everyone as well. So that you know, if you've been there, it's very well organized. It's about 30 minutes from the time you get in the door until you get out the other side. And we're hoping that will really encourage not only you, but everyone else that comes to the clinic as well. So that's my report.
Thank you very much. Very comprehensive. Does any member have any questions with regard to the report we've just heard? Go ahead, Doug Struthers.
Thank you very much, Mr. Chair. Not so much a question on the Dr. Stewart's report, but more a question in terms of ensuring we get, I don't want to call it conflicting or messaging, but with all this encouraging news, and it's encouraging because of people's behavior in terms of when they're out and about. This is before, and then when we got to step 1, a little sidebar, what really, really upset me was there people were, I won't say where, but anyway, at 12:01 going to the patios because already the patios are open. And now we're going to step 2 because of good behavior, but the number of vaccines that people are getting their first dose and now getting into the 2nd dose, and the COVID of late that has been infecting people has been predominantly the variants. And all the variants mean, from my perspective, is they're more easily transmitted. It's still COVID, right? Doesn't matter which variant it is. It's still COVID. So we still need to, now that we're in step 2, when you have more people gathering inside, outside, very, very prescriptive, and, more people going in stores and so on, we still need to pursue getting your first vaccine, pursue getting your second vaccine. But in the meantime, in step 2, which we're going to next week, I believe, we still need to be vigilant and not get overexcited and say, hooray, hooray. There's a certain amount of celebration, if you will, that everybody's doing a great job, but we still need to be vigilant with social distancing, wear your mask, wash your hands. And so I guess, a wee bit of a concern that some people might think we reached Shangri-La. We haven't. It's step 2.
Yeah.
There's still quite a ways to go to get to step 3, and everybody still needs to behave according, behave in terms of good practices, but be vigilant following the guidelines of step 2. And I don't know how we incorporate that in the messaging, because it is important to get the prescriptive messaging of what step 2 means. But let's not lose sight of the fact we all individually and collectively have work yet to do. So
Yeah,
I'm not sure,
thank
Dr.
you, Doug.
Stewart, how either on our website, the health unit, or, I've made these comments, as you know, in our previous Friday morning updates from you. So having said that, I'll stop talking and leave it to you, Dr. Stewart, to comment what we made.
Yeah, well said. And actually, it thrills me that you said it so eloquently. I think if everyone in the community said it as well, then we'd be in good shape. We're only 20% have 2 doses of vaccine. And with the Delta variant, then that's somewhere between 35 and 40% protection. It goes way up to 90 once you get 2. And so I entirely agree with you. The focus has to be on following precautions so that we continue to have the low numbers that we do. People aren't getting sick, people aren't getting hospitalized. And it means that our businesses and services can start to function well. And so it's almost like we have a duty to them when we're in their site, is to follow the precautions so that they continue to be open and get the vaccine. That's what's really going to make the long-term difference. So couldn't agree with you more. And I think that those are my media messages. That's the information we have on the website. And I think if each of you can be doing the same way as eloquently as you did, that's really important.
Okay, thank you very much, Dr. Stewart and Doug Struthers. I think you did capture that well. Go ahead, Peter McKenna, you have something?
Yes, thank you, Mr. Chair. I didn't know where else to fit it in on the agenda, but I know Dr. Stewart will be open about this. I noted that it's Dr. Williams' last press conference today, and I was hoping that the board would send him a huge thank you letter on behalf of all of us for his leadership throughout the pandemic. And then perhaps, if the board agrees, a second letter to welcome Dr. Moore and wish him all the best, and let him know that he has our support in his role in the next phase. So just wanted to, I didn't know where else it might come up, but those are my thoughts anyways.
A very great suggestion, Peter, and something that we'll follow through, absolutely. Thank you for that.
Yeah. Yeah, I've actually I've worked with him closely on several projects over the time, and so and we were all able to submit a message that would go into his thank you book. So I think that would be a wonderful, wonderful thing for the board to do. Doug, you and I can work on that.
Yes, absolutely. No, that's great. Thank you for the suggestion. All right, before I move from this point of the agenda, because we're getting just into confirming the date, time, or location for next meeting adjournment, I just found it ironic, Dr. Stewart, when you said that the board's going to do its part by participating in a clinic. My goodness, as I've repeated many times at our board meetings, the health unit is just gigantic in terms of all the work it's done and its commitment, dedication, And I've often said we're into the heroic scale of effort. And so the fact that they think that there's a step needed in order to participate in the vaccines is just another sign of their commitment. So again, I hope you will, next time you meet with them, communicate the thanks and gratitude of the board.
Okay, will do. Thank
Okay.
you.
Then I'm on to 8, which is just confirming the date, time, and location of our next meeting, which of course is Thursday, July 22nd, 2021. And with that, up comes the motion for adjournment. And so Doug Struthers, it looks by you indicating this might be a short meeting. There was no hex put on it. And they're not all short, but this one is.
Yeah,
So-
well done, Mr. Chair. Well done.
I have a motion, and I'm not certain if Bill has left it. It's moved by Bill Dobson. Are you still there, Bill?
I believe he left the meeting, Mr. Chair.
Then I'll
be-
change that
I'll-
to Jeff Earl, seconded by Peter McKenna, that the meeting do now adjourn at 4:40 p.m. Is there any objection to my declaring this motion carried? It is so carried, and I want to thank everybody for very quick meeting, very thorough. Thank you all.
Thank you.
Thank
Chair.
you. Stay safe.
Bye-bye.
Enjoy your evening.
Goodbye,
Right.
everyone.
Bye. Stay safe.